Well, speaking of relapse and the fact that my daughter is on the DFMO trial for kids in remission, she has about 4 cycles left until she's on, just had cycle 23. I know the data's not there to prove whether that's going to be enough or not. But my question, because I'm always afraid of relapse, is there, what is the reasoning behind stopping at the 27 months? Is there any possible benefit to continue on that? I loved hearing the science behind the targeting the stem cells yesterday, and that makes sense to me. But is it eliminating it for good? Are those cancer stem cells being eliminated for good? Will they come back? Or is 2 years going to eliminate them enough that I don't have to worry about them coming back? I guess those are all my questions, and I know that's why you're having the trial, but do you have any answers to that? To this point?
You just answered all now, so that I wouldn't have to worry.
We unfortunately don't know how long is long enough. The adult studies used 2 years, so that was one of the reasons. In leukemia, after upfront therapy, generally there's about, depending boy or girl, about 2 years of maintenance. Again, that's to prevent the relapse in leukemia from coming back. So that seems to be a standard in other diseases. For neuroblastoma, we don't know. We don't know if 2 years is enough, or does it need to be 4 years. And we have discussed many families from many of our other institutions, as they come up on the 2-year time mark, don't want to stop. And it has very minimal toxicity or none in most kids, and they're doing well, and the tumor hasn't come back, and why do we need to stop is what I'm hearing. You know, we've discussed it in the NMTRC, you know, and I think the children who are up front will be stopping at the 27 cycles. The children who weren't, you know, difficulty getting into remission or relapsed and then got into remission, who are on the second arm, they're a much higher risk group. And so I know that there's been discussion as to whether that group may be allowed to stay on a little bit longer, depending on the family. So we don't have the right answer.
So are you open to looking at that, though? Are you open, or do you have the opportunity to be open to look at that?
Yes.
Not for
the first arm. The second.
not for your patients.
Hypothetically.
Let me make a point about that, though.
Sure.
Cut that word out.
What we also don't know, I mean, I think you do have to pick some time frame.
Sure.
And in treatment of ALL, which is a much more common malignancy, parents said the same thing, and doctors said the same thing. When we were curing 60% of patients. They said, well, what if we did 5 years of maintenance? And so they did that, 5 years of maintenance, and it made no difference. That had no impact. So it's hard to conceive that one drug in a tumor as crafty as neuroblastoma, you know, that one drug, the 2 years, you know, that 3 years is going to be better than 2 years. Mm-hmm. So I think even scientifically, that doesn't make a tremendous amount of sense. The other thing is, we don't know what giving DFMO to a child for 4 years may do to them. You know, are we going to affect their risk of second malignancy? So I think to have some truth to the study, to say, yes, this is what the group decided is this study. Before you go, do you agree with that or yes? That then you say, okay, it looks like 2 years is our best assessment at this point. And I get the insurance issue that you want, if this could guarantee, but when we don't know, then we also don't want to do any harm.
Right.
So many improvements in the world of neuroblastoma over the past 10 years. How do I know that a cure might not be found next year? And if I were to able to keep her on DFMO and have that option to keep her on DFMO for another year or two, and there might be a cure, That's our mind frame.
Does the
Exactly.
disease get immune to the drug after a while?
Sure, we know that tumors, that's the biggest problem in neuroblastoma, is that there's, the development of drug resistance. And we understand some of those pathways, but we definitely know that it becomes resistant to many drugs, and that's why it's much more challenging at relapse than it is up front. So I understand the thought process, but I also am true to the study, and so Dr. Scholler was saying, well, maybe it's different if you've relapsed and then you're back in remission and on that trial. But, I think being true to 2 or 27 cycles is important, partly for the child's safety, as well as to see is that going to be enough. And I think it's hard to conceive that if a tumor cell's going to develop resistance, it won't do that in 27 months. That's a long time. It's either going to be resistant or sensitive. Does that make sense?
I think that's an understandable thing. There's a big, like Pat said, there's a big burden at relapse on you. And part of that burden is, okay, after relapse, my kid is NED again. I don't know if I want to let go, because there's this big fear that it's just going to happen again. And I think it's a hard thing. It's a hard shift for parents to go from the having directions to not having directions, and then kind of just being cut adrift when you're done.
I think what's pretty amazing is that when the study was opening, the idea of having this conversation, it's pretty amazing that it's taking place. I think it's pretty extraordinary that you have people that are coming up on that 2-year marker, and you have to face that fear, and you have to worry about that as a parent, as a caregiver. I think it's terrifying for the parents. And I went through that same decision myself on phase 1, and I had to stop eventually. And it was to the safety point. When we got to that 1 year, I just didn't want to. Ended up going another 4 months. Ended up halving the dose because we were concerned that it wasn't a chronic side effect. We were starting to worry. In my 6 to 9 year old, 5 to 8 year old, what long-term kind of issues might be creating here that might have been solved already with this treatment. So I know I understand what you're saying. It's a very scary time. I'm not belittling that, but I think it's pretty exciting to recognize that this is pretty amazing that we have families worried about how do I keep on this drug, and I think that's just worth noting.
Particularly, there are other chronic diseases that you take things for life.
Yeah.
Yeah, you take
I do
drugs
right
for
now.
life, right?
Yeah.
So, and you don't know what the long-term side effects, but you know you're going to be taking it for life.
And isn't a part of that conversation is that even with the term NED, and the high reoccurrence rate, one of the issues, and correct me if I'm wrong, is that doctors think maybe we just aren't able to actually see the disease and it actually is still there, and that's why there's such a high reoccurrence rate. So I think maybe one of the questions that's at the heart of your issue is DFMO killing off what's left of the neuroblastoma, or is it keeping it at bay? And so that's kind of a question that I think would keep me up as a parent is, did that 2 years eliminate the neuroblastoma in my child, or is it just letting it not grow? Because those are the answer to that question, which we don't obviously know, answers your question, because you don't know which is occurring.
I think another important point too is that this is a clinical trial, and it's not an FDA approved drug yet, and we all know that going into it. Our kids are going through this with the parents know what we're putting the kids through. We know there's a time frame, and we know that we're part of a process to get this drug approved so that kids in the future can benefit from this. We have to play by the rules so that future kids can benefit from it. So.
And not that it's going to help you sleep at night, but
right.
There are 2 phase 1 people who've gone off and haven't done anything else and have done well. So one child's my own, another child I know from the clinic, but I still follow and stay in touch with. seeing him for a year ahead of my son, he went off therapy. That gave me a lot of hope. I continually bothered his mom to see how he was doing, because we did make that decision. You know, yeah.
We stopped you.
Legal proceedings, but we'll leave that.
But it hasn't been instantly proven that when you get off study, it just turned out that kept it at bay
Correct.
instantly.
So those, yeah, and the other mom I don't know very well, but those are the two people that I can that have seen these children. They stopped DFMO. They were multiple relapsed. You know, other options were exhausted, and that gave me that allowed me just to feel better because there was someone else who just stopped, didn't go on any other therapies, and he's doing really well for over a year, and that allowed me just to kind of broker that decision alone where I could stop because I felt better. It gave me some hope that he was doing that. I know that doesn't help you, but it just.
Well, and on the contrast, the kids who progressed on that phase 1 DFMO did so much earlier. But I feel your agony. I mean, I feel your, like I can empathize